I can't believe it. Again, I met a potential client here at the coffee shop, and they ended up going with someone else. Said they wanted to work with someone who looked more established.
Oh no, that's unfortunate, but honestly, why are you still meeting clients at coffee shops? You should check out J. Kenba Executive Suites.
J. Kenba? Never heard of it.
Really? It's a professional office space right here in Baton Rouge. You can rent an office that's already furnished, plus they include Wi-Fi, secure building access, utilities, on-site parking, and they even handle the regular cleaning. All you have to do is show up and focus on your clients.
Wait, they handle the cleaning too? That sounds way easier than trying to make my home office look professional or hunting for a quiet spot at a coffee shop.
Exactly. And if you don't need a full-time office, they even rent out conference rooms for small meetings and workshops. Perfect for impressing clients without the overhead.
That's exactly what I need. Where do I find out more information?
Just visit jkenba.com and schedule a tour. Trust me, you'll wonder why you didn't do this sooner.
J. Kenba Executive Suites. We provide the professional space. You create the success. Visit jkenba.com today.
Welcome to the Byja Radio Show. I'm your host, Dr. Byron Jasper, and we are recording live with special production by Becknell Media. Yes. We are back in the saddle once again for the amazing Byja Radio Show. I'm over here messing up right out the gate, man. I don't even know what's going on with me. So the amazing Byja Radio Show. I'm your host, Dr. Byron Jasper. And if I am your host, that must mean that I am in the seat when I say we are back in the saddle with the amazing co-host, the one and only PatientZero. I mean, again, I cannot say this enough and I cannot understate this. This man is a phenomenon. I literally have on my LinkedIn page a comment that literally says, people tune in for the PatientZero conversations. They didn't say anything about me. Now, mind you, it's my page. No one said, Dr. Jasper, you're great. But like it was just automatically, I'm ignored. So I'm starting to realize what it feels like to be one of the Jacksons. And you got the Michael energy, my brother. So I must be talking about PatientZero. What's going on, brother? How are you doing?
Hey, what's up, brother, man? I'm doing well, man. Look, I don't know if I got Michael energy, because Michael's the GOAT, man. You're talking about the star of stars.
Mm-hmm.
I feel like it's like Jesus Christ and then Michael Jackson next when you're talking about the star of stars, right? You know what I mean? Michael Jordan
order
might be third.
In that order?
You know what I mean? But like I feel like Michael Jackson is like famous people celebrity.
Gotcha.
Right? You know what
So
I mean?
people
So
would-
he's
people would
famous
freak
among
out.
famous people. Yeah.
Okay,
For
that's
Michael
what they-
Jackson. Yeah. So like I remember watching the Super Bowl when I was a kid,
Mm-hmm.
and Mike comes out on the Super Bowl on halftime, and people just start passing out.
Correct.
Like, just he hits the stage and people like passing out, and I'm like, they gonna miss the rest of the game. They getting taken out of the stadium. Just I didn't understand it. So I do not think I have Michael Jackson energy.
Mm-hmm.
Maybe a little David Ruffin energy. Maybe just a little bit.
So basically, I'm Otis, is what I'm hearing.
Hey, I am PatientZero, and this here is the Byja Radio Show, and
I
that's
like
how we
it.
go do it.
I like it. I feel like we got to change the intro at this point. That's all I'm saying. So I will go back to your first point, though, which cracks me up. The fact that you literally said Jesus, Michael Jackson. I'm feeling like there's at least 2 or 3 more in between, but you went straight to
No.
Michael Jackson.
No,
So-
who's in between Jesus and Michael Jackson?
I'm not saying that you're wrong about him being a celebrity among celebrities. Like people would freak out even if they're a celebrity to Michael Jackson. But I'm thinking you're going to go like historic figure that like changed the way people live and things of that. Not that made them feel good. I'm not knocking that. Mike had that. But I'm thinking you're going to go like maybe Gandhi, somebody like that, Mother Teresa, like these people
Bro.
who are like
No,
that
bro.
kind of thing. Now, again, I'm not saying you're wrong. I just thought that's you were going to sneak one in and then go to Mike. But the fact
Nope.
that you skipped over all them and straight to Michael Jackson, that's
Nope.
funny.
And I love our frat brother, Dr. Martin Luther King.
Correct.
Love him to death. Wrote many papers on him when I was a kid and all this stuff. Martin Luther King has done way more for black people, obviously, than Michael Jackson will ever do or
Correct.
has ever done, right?
Correct.
However, Martin Luther King could come sit in the room and maybe a couple people care. Michael Jackson comes sit in the room, everybody's like, oh my God, that's Mike. Including, like, if Dr. King was alive when Mike was old, like, Dr. King would be like, hey man, that's Michael Jackson.
That's a bad man right there.
That's a bad man. You know, I've been on the mountaintop, I've seen it, and it's Michael Jackson's concert. You know, like, that's just what it would be.
Oh,
I'm just saying.
That's funny. So Martin Luther King would nerd out over Michael Jackson is what you're saying.
1,000%. Absolutely.
Okay. What's the least likely celebrity that you think might nerd out over Michael Jackson if we had to do that?
The least likely celebrity that would nerd out?
Like someone you don't
Jackson?
expect that would probably be an absolute Michael Jackson fan that you would be like, I would never guess that.
Dead or alive?
Dead or alive. Yeah, absolutely.
Hitler. I could see Hitler jamming to Michael Jackson.
All right. Good night, everybody. That's the end of the episode.
I can see it.
I don't even want to know how you got there. The fact that I asked, I feel bad for myself and my future self watching this part of the actual show. But the fact that you took it there, that just tells me.
You said somebody who I wouldn't expect. That was the question. It wasn't somebody who I would expect. It was somebody who I would not expect.
I was thinking in my mind, simple mind, I'd say that, like, keeping it as basic as possible. You were going to talk about somebody who's super masculine, right? Like, oh, I wouldn't expect this person because they're like super gangster type, you know, image, like persona. The fact that you went to a guy who's, committing flat out genocide is like,
Bro,
whoa.
That's what I'm saying. That's why you wouldn't expect him. But also, think about this. You could be gangster and still kind of fan out. You know what I mean? Like, you don't have to be like, you don't have to bring like weird energy. You could be like, oh, hey man, wait. That's Michael Jackson.
Mm-hmm.
What are you doing here? Like, that you can kind of fan out that way, and it's not like you still be gangster, you still be hard. You know, like,
and that's why that's why I didn't expect it. But yeah, you definitely took. Like
you said who I wouldn't expect. Hitler is somebody you wouldn't expect. But you know, he's somebody that gave Jesse Owens props in the 36 Olympics.
Oh, I'm not going to take that away to say he wouldn't have been that. I just didn't think you would have went there. That's what I'm saying. Like,
so
like,
my mind went against somebody when you said who I wouldn't expect.
Mm-hmm.
My mind went to somebody who's hateful and who's a terrible individual,
mm-hmm.
and would like somebody music like Michael Jackson.
Gotcha.
That's where my mind went.
I got you.
So I thought of the worst person possible.
I got you.
That was my rationale.
I'm not mad at it at all. I'm not mad at it at all, my friend. Well, if you have not been to the Byja Radio Show, that's just a preview of what you're going to get with this. So we're going to talk today on episode 42, my brother, season 4, episode 42, about basically the latest news in healthcare in America. And why are we talking about this, PatientZero? Well, it's because I've heard quite a bit about it now that the legislation or the legislators are now trying to come up with a new plan that may eliminate the ACA and the subsidies that are attached to the ACA in light of something where they're basically giving the money and the funds directly to you and me, the consumer, my friend. So basically a direct payment potentially to you to then use and do what you want. So when I saw that, I said, man, this might actually be something helpful. And then much like I expected it, that thought lasted all of 20 seconds because I was like, it can't be that good. It can't make sense that much. It has to be something that's going to get screwed up because, again, we got a bunch of very, very, very distant people in these seats trying to somehow write legislation on healthcare for people that they probably will never meet and come across other than when they're trying to get votes. So, of course, as I read more about it, I was like, okay, now they went back in United States government, right? They did that to the point where they botched it before it even gets out of the starting block. So what we're doing today is trying to unpack what this proposal is from the legislators on the Republican side that is going to potentially be the remedy or the reversal of the ACA. And by doing that, my hope is that people who listen to us will say, okay, I've heard about this. I didn't really understand it. Now that I do, I can kind of see where the pros and the cons may be. So PatientZero, we got some notes in front of us. I want you to hopefully give us a quick breakdown on some of the things that are discussed that may lead to how we got to the plan that is being proposed. Things about the ACA, subsidies, all that good stuff. Now, we talked about it a few episodes ago, but let's give the people a quick high-level approach on that.
Cool. So, clearly we're talking about ACA subsidies, right? So, Affordable Health Care Act subsidies. They're tax credits provided by the federal government to help people afford health insurance through the Affordable Health Care Act marketplace, right? So you go to healthcare.gov, I believe it is, and you search for a new healthcare plan, and there's subsidies to assist, right? Who gets them, right? So in 2025, 92% of people who enrolled in the Affordable Health Care Act receive subsidies. So about 22 million people. 22 million people out of a possible 24 people enrolled in the ACA, right?
22 million out of 24 million.
Right. I didn't say that?
No, you said 22 million out of 24. You didn't say 24 million. You just said 24. You missed that million.
Wait, man. You can't have 22 million out of 24 people. You know,
that's that Cajun math.
Man, look, that's some of this. Well, I'm not gonna go there, but trying to stay on there, brother.
There you go.
Look, these subsidies, what they do, they cap the amount of people pay based on their income and cost of coverage in the area. You know, so essentially, people earning up to 400 to 600% of the federal poverty level are eligible. So what's the federal poverty level right now? Do you know?
I do not offhand. That is one thing I did not pull, but I do know it's pretty low.
Yeah. So, you know, if I had to guess, I would say this is something somewhere around 50, 60 grand at the most.
Yeah, I'm looking it up.
People are making that's eligible for this. So essentially, the subsidies, the way they work, they're applied directly to insurance premium, lowering the monthly cost on the front end, right? Some also qualify for what's called cost sharing reductions, so lower deductible, lower co-pays depending on the plan type.
All right, let me jump in real quickly before we go on. So to answer your question, for 2025, the federal poverty level, one-person household is $15,650. Two-person household is $21,150. And we're going to jump to a four-person is $32,150. So obviously, if you make at or below that, you're below the federal poverty level.
So for four people, the federal poverty level is $32,000.
$32,150. So if you're 400% lower than that, then obviously that's going to be at that poverty level. That, if I'm reading that correctly.
Well, it says people 400% to 600% of the federal poverty level.
Gotcha.
So in that instance, 400% is $120,000. That go to show you how expensive life is. To where you can, you got a household income of $120,000, and you need the Affordable Affordable Care Act. Excuse me. That's, man, it's tough sledding out here in America, bro.
Yep. Well, that's according, again, to the, hold on, let me make sure I say this correctly. I am looking for the name on the website that I pulled this from. And apparently this is the Clinton County Regional Educational Service Agency that's stating these numbers from 2025. So at the 400%, and I'm going to see if I can read this correctly. It says in essence, if you have a household size of 1, 400% as of January 15, 2025 for
Should
the
be about
48
$60,000.
contiguous United States, $62,600
Right.
annually.
Makes sense.
Yeah. So people, as you just said, for $128,600. So you're spot
Makes
on, my
sense.
friend. You're making
Yeah.
$128,000 with 4 people in the house. You're still potentially 400%. So a lot of people are getting these subsidies, if we're understanding this correctly. Is that right, PatientZero?
So that is correct. And and a little off the cuff, man, I just think about when I was a kid, family of 4 million, 120 grand, you was balling.
Mm-hmm.
Now it's like you making 120 with how expensive things are. You need help. That's
You out here having to wonder why you thought adulting was a good thing. That's what you're having
bro,
to think about,
that's
right?
another topic, because
Yep.
that's the biggest joke in life. Like, if there's a life riddle, is every child is like, I can't wait to grow up
Mm-hmm.
to come live in this. That is the biggest riddle ever to me.
That's why Peter Pan is still so timeless, because Peter Pan didn't want to grow up at all, and he had it right, in my opinion.
Yeah, I would agree. I wanted to grow up so I could drive and buy what I want and do what I want. And now I'm wishing I still had access to the groceries that my mom and daddy bought.
The parentals.
Still wish
yes.
still wish I had my little room for free.
There you go.
The
I
good
get
old days.
All right, let's get back to the topic, my friend. So we were saying about the subsidies, how they work, and basically that a lot of people have access to them. It's not just the quote unquote poor of the poor. It's quite a few people who might fall into that quote unquote 400 to 600% of the federal poverty level. Go
Correct.
on, my friend.
And the average person enrolled in a subsidized ACA plan in 2025 pays about $888 a year for out-of-pocket premium. So about $900 a year. That's nothing to sneeze at. That's still, with all these credits and with all these discounts, that's still short, maybe about $70, $80 a month, short, right under $100 a month. That's another bill.
Mm-hmm.
So that's not cheap at all.
So going on from there, I think the other part that is important is, as we've talked about, if the ACA or the Affordable Care Act expires, then those subsidies are going to go away. That's the shortest way of kind of summarizing it. If you're interested in kind of hearing us on our deep dive about that, check out episode 38, where we spent a lot of time talking about what happens with the subsidies, how they work, what happens if they go away, the pros, cons of that. So we automatically know subsidies are there. We know that they are important. We know a lot of people get access to them. And we know that right now, unless something changes, they're about to go away. And if they go away, the premiums are going to skyrocket. We definitely spent a lot of time talking about that. If I did my notes correct this day, as we're recording, I wrote the average yearly premiums would jump from roughly the $880 something you mentioned, PatientZero, to about $1,900 a year. So they they expand by over 114% from where they are now, if the subsidies go away. So I don't think anybody's going to argue that that's a huge jump, and that's ridiculous. So I think we are safe to say, most people agree, that's a problem. All right. Are we safe on that, PatientZero? You agree with that?
1,000%. Anytime something goes up, it goes up by more than what it actually was, then it's a problem.
Yeah.
You know, it was only $888, and now it's going up $1,100. It's a problem.
Yeah. I mean, the only thing that hopefully would go up like that and you wouldn't have a problem is your salary, right? Like, I'm making this money. I'm not going to be upset that it increased by 100%. Otherwise, if it's an expense that's increasing by 100%, it's a problem. So what does that take us to, PatientZero? So this is the point of today's episode. So there is a plan that is being proposed by the Republican side of the legislature, and the Republican side has come up with an idea of this, what we're going to title the Healthcare Freedom for Patients Act. Healthcare Freedom for Patients Act. Now, this could be changed. The name could go to whatever we want to call it in the future. But first and foremost, let's just start with the name sounds ridiculous. Okay, I'm confused at what's going on with it as I read the name out loud. The Healthcare Freedom for Patients Act, I'm confused. Okay, Healthcare Freedom Act. Hey, that would have been simple. In my mind, I think we didn't need for patients, because right now it sounds a little repetitive to me. Who else would you be giving freedom to in healthcare? I mean, it could be Healthcare Freedom for Physicians Act, but that sounds a little ridiculous to me. So first and foremost, we need to work on the name. That's the first thing. I think that's pretty consistent. And I don't think anybody's going to be upset about me saying that. We can come up with better name, less words. I'll say this, and this is my little soapbox for today. I was always taught that if you need to say something and it really only takes 4 words to say it and you're using 15, then you're doing too much. So the fact that we're adding extra words trying to make stuff sound fancy, then it's just showing you're doing too much. So we need to just drop the idea that let's add more words because it sounds better. That's just me. PatientZero, what are your thoughts on the title?
Well, I think you don't understand the unwritten rule. Anything that the Republicans do, especially MAGA Republicans these days, they have to have the word freedom in it, no matter what it is. Whether it gives you freedom, takes freedom, has nothing to do with freedom. The word freedom must be in there. Because, I hear this name and I'm thinking, Healthcare Freedom Act for Patients. I'm with you. Why do you need the for patients in there? But hey, whatever. So I'm like, freedom. Maybe this is freeing me from cost or freeing me to choose to make better decisions. And it does neither of that. Yeah. So absolutely, the name needs work.
Needs to change. Well, besides the name, the other core concept of this act, the Health Care Freedom for Patients Act, is that it's supposed to replace the Affordable Care Act subsidies with direct payments into health savings accounts or accounts that are similar to health savings accounts, where basically the government is going to give money directly to the patient and put it in an account that literally is tax deferred so people can spend it on healthcare related expenses. So in theory, conceptually, I like where it started, PatientZero. I'm going to be transparent. I'm going to be honest. Hey, instead of me potentially giving my money to an insurance company and quote unquote, the insurance company now has an inflated cost, we're subsidizing the cost so patients think they're paying less, but the insurance company is still getting the funding directly from the government because the subsidies are in essence going to the insurance company, right? We're going to take some of that funding and give it to you and me. I think that makes more sense rather than giving it directly to an insurance company. So I thought that was a great idea conceptually. But instead of giving the money to the insurance company and giving it to us, and then saying, let's make sure we do what, in my mind, do it equal to what we're potentially giving the insurance company, these people literally just missed the mark completely. PatientZero, do you know the number they came up with for individuals to give you and me money compared to what they've given to insurance companies?
I know what they're giving you, like a flat $1,000 to $1,500.
$1,000 for a year. I was like, oh, maybe it's a month. It's $1,000 a month. That's actually pretty good. These, and I'm going to not use profanity today. These people literally said, we're going to give you a strong $1,000 for a year, for 12 months. And literally, you're going to find a way to get health care for $1,000 for 12 months, all inclusive. Do they think this is Cabo? Like, are we getting money in pesos? Like, I don't understand. How did they come up with $1,000 for individuals? And my favorite part, because clearly, if one is $1,000, then a family must be, I don't know, 4,000, right? Hey, 4 people, 1,000 per person. What is the number that they came up with for families, PatientZero? If you guessed $1,500 for a family, who did this math? Let's start with that. Like, who got in there and said, I got it? It's $1,000 for one person for 12 months. How much is it for 4 people in a family? $1,500. Yes. Like, who came up with that? This math is atrocious. Okay.
It's awful. And I just want to put something in context. So I started physical therapy in November. And I hadn't had $1 towards my $800 deductible before I started physical therapy. And I started in November. It is now December. I have hit that $800 deductible.
In a strong month and a half, 2 months. Because December ain't even over yet. That's what I said. December not even over yet.
So I've hit it. So what I'm saying is $1,500 for a family of 4 on medical expenses.
I don't get it. I would think that exponentially the number would go up. As we have already indicated, when families potentially grow, the number should grow probably as the number of people and be somewhat exponential. This
But
bad boy,
I hope them kids don't play no sports because a sprained ankle is gonna take that whole 1,500.
1,500 is gone. 1,500 is
It's
gone.
out of here
It's
with no
gone with
insurance.
it's gone with the whole household getting sick one time. Like, I mean, it's crazy. So who came up with that? That's why I said the name was bad. The concept was good. Then the math was atrocious. And again, I don't know his name, but I'm just going to say if it was somebody in the room, and let's just make up a name. If it was Chad, you need to be fired. Okay. Because I can imagine when they literally came to you, you thought you was on fire when you came up with it. And they was like, tell me how you came up with this math. And he was like, you know what?
Well,
What is math? Math
well,
is a figment of your imagination, my brother. And he just walked off. Like, I feel like that's what he did.
that's where the freedom comes from. Because Chad now has the freedom to pursue another career. Because this is foolishness.
Chad has the freedom to make up whatever the math is that he came up with to go from 1,000 for a one person to 1,500 for a family. Like, Chad needs to literally do something else. And I'm hoping he is somewhere in a different country working on something that has nothing to do with policy or math, right? Let's just go ahead.
I hope Chad is back in school pursuing a professional degree.
That's going to be a different episode, but I agree with you. So based off of that, again, conceptually, let's just go ahead and bring it back to center. The act is supposed to be, hey, let's give the money directly to you and me, the families, everybody who potentially could benefit from a subsidy. We're going to instead give them the funds. Okay, great. How much are you going to give us? Not even close to what we give the insurance companies. We're going to give you a drop in the bucket. And then some people will say, well, it's just the idea. We haven't really worked out the numbers. Well, if you starting out at 1,000 and you think somehow that these numbers are going to in any way mirror what is in this whole Affordable Care Act, we are sadly mistaken. But at least let me give a little bit more facts, PatientZero. What is the money supposedly able to be used for with this new act from the Republican legislators? It says routine care, whatever that means. Prescriptions, some mental health care, because clearly we don't need all mental health care, just some of it. We don't need all of it. We don't need the anxiety piece, the depression. No, I'll stick with that. We don't need the schizophrenia, maybe a little bipolar, like just a couple of things, just a couple. We don't need all of it. So some mental health care. And then from there, it's kind of that's it from what I know. It doesn't include potential things like surgeries. It doesn't include hospitalizations and emergency room visits. Maybe it does include urgent care. Maybe it doesn't. But that goes to show you that the idea is that it is a very limited thing that you can use these funds on. And based off of that, what does it not actually cover in my mind? It doesn't actually cover insurance. Like you're telling me I still potentially need insurance. The prices are now going to skyrocket because now that we're putting this plan in place, it doesn't stop the insurance from going up. But I just give you $1,000 and now you can go and cover yourself for a month and a half for your, like, it's insane who came up with this and said, you know what, I think it's a good idea. But you know who came up with it though? You know who was one of the lovely, lovely senators who came up with this idea? Let's just say he in your backyard.
Oh, not Kennedy.
Cassidy. Oh. Bill Cassidy, who is a physician.
That's the doctor.
The doctor came up with this idea along with one of his colleagues and proposed this, and that's what we're starting with. And again, I like the idea because Senator Cassidy has actually been pretty good to the DPC people with helping in Louisiana to get DPC a lot more momentum. So I appreciate that. I'm never going to knock him for that. But who came up with these numbers and how narrow this is? That's the part that just floored me. And I was just completely baffled by it, thinking he would say, you know what, we need to really increase this and do better.
I'm still stuck on this $1,500. So like, are they going to let the children go to school? Because you know, you send them to school. It's like
Petri dishes.
A sick pattern. You know, like everybody just gets sick 3 times a year. It just goes from kid to kid to kid to kid.
Yep.
And if it's not the cold, is the chicken pox. Well, they don't have chicken pox no more apparently, or they made a comeback.
Yes.
Like chicken pox and measles made a comeback, but all these kids infecting other kids, that's gonna knock out that 15. Mom and dad can't even get sick.
Correct. And that's the whole point. That's crazy. So when you compare them side by side, you said yourself, PatientZero, that the average premium potentially in 2025 under
It's
this
$1,900.
Oh no, I was gonna say under the Affordable Care Act,
it was $888.
$888. So we'll round up $900. Then, if we don't do the thing with the subsidies and keep them, it's going to skyrocket potentially to $1,900.
$1,900.
Now, that is in some cases, but in other cases, it could be even more than that. So you're going from, with the subsidy, about $900 to no subsidy at all, well over $1,900, potentially $2,000, $3,000, $4,000, $5,000 in 1 year. Because again, we didn't fix the subsidy thing. We just basically say we're going to give you the money instead. And with that, the subsidies go away and the price still goes up. So that's the first thing. With the plan, the Affordable Care Act, there is a 70 to 90% coverage of your premium with the subsidy. Again, now the money goes to the insurance company, so you don't see it, but the insurance company now lowers the premium because they receive the funds directly from the federal government. Now, instead, they're going to take the funds and give it directly to you, and it pales in comparison to what the subsidies were that the insurance companies were getting. So where's all that extra money going? I'd love to know, because clearly it's not going to the people who need it most, especially those who are potentially in that household of four that are getting a strong $1,500, PatientZero. For that, the idea is that right now there is no risk adjustment based on income. Like, hey, you have a lower income, you may get a higher subsidy, which lowers your premium. Right now, everybody gets the same thing. And then last but not least, pretty much anybody would have access to the $1,000 to $1,500. Whether you're a healthy person, a high income person, you're going to get the same as a low income person who's ill and may need more funds. Everybody gets the exact same. It's this idea that everybody is equal, so we're going to treat everybody equally, which in theory out loud sounds great, but in real life, it's actually stupid. That's the best thing. Like, instead of it being equitable, where a person who's really sick gets more compared to someone who doesn't need a lot, they get less. They're making it equal, and equity is getting lost in exchange for equality, and that's the problem. So that's why this is huge in terms of missing the mark. And again,
I don't understand, how does help be equal?
Yeah, and that's why I said whoever's sitting down going into these rooms and saying we're going to pitch this idea that if we just give the money directly to patients and consumers, it's going to be great. In theory, it would, but it's not going to be great, because the main thing we're going to run into is people are going to literally not have enough, and those who need more are going to end up with less. And the people who are going to sit there and basically sit and point the finger and say, well, look, why is this not working? They're going to be surprised when people like you and me could have seen this a mile away, 10 miles away. We literally are telling you that this is not going to work unless you change these numbers. Because from what I'm understanding, PatientZero, last I checked, you said that $1,000 potentially got burned through in a month or a month and a half, and that wasn't even a major issue for something simple like physical therapy. Imagine, as you said, something like a hospitalization, an emergency room visit where there's a broken bone, a diagnosis that's very, very terminal or severe. Like, that's going to wipe out stuff immediately.
Well, what about an insulin-dependent type 1 diabetic?
Correct. Somebody who needs a lot and is going to need a lot forever. You're coming up with this random arbitrary number that doesn't really do anything. So I think we've done a good amount of justice, at least painting the picture about this plan and where a lot of the issues are lying. But I think we still got a little bit more that we need to cover, and we'll do that right after this break. Hello there, it's Dr. Jasper from the Byja Radio Show. Are you tired of the broken healthcare system? Frustrated by long wait times to see your physician, rush visits, and the sky-high healthcare costs that come with those rush visits? Yeah, I hear about it all the time. So if you're tired of dealing with any of those things, then I highly suggest you check out the book Byja Blueprint, an introductory guide to direct primary care for patients, physicians, and businesses. Written by yours truly, it breaks down all you need to know about direct primary care, a model that makes healthcare simple, affordable, and personal again. The book covers topics like how DPC differs from traditional insurance-based healthcare, what's the difference between direct primary care and concierge medicine, how employers can use DPC to cut healthcare costs, how this model reduces burnout for physicians and improves work-life balance, and so much more. Whether you're a patient, a doctor like myself who was fed up and burnt out, or a business owner tired of rising healthcare costs, this book lays it all out in plain English. So if you're ready for something better, check out Byja Blueprint, available in paperback, audio, and ebook format. Visit bookstoread.com/Byja Blueprint DPC and get your copy today. All right, Patient Zero, we're coming back in from commercial break, and we are diving into the Healthcare Freedom for Patients Act and how this is potentially a good, if not good, somewhat of a possible idea that may go somewhere, maybe, maybe not. And then from there, what are the pitfalls of this actual piece of legislation that is being proposed within the lawmakers of the United States government? So we did a lot of where we see problems, but we're equal opportunity journalists. So based on that, Patient Zero, tell me any pros you hear about this actual act that could be perceived as, hey, this is a positive thing.
So the positives, it gives patients control over their healthcare dollars, right? So
I agree.
So, it goes to your HSA. You can kind of do what you want. There's no network of people that you gotta follow. You just kind of go see who you want to see. Mm-hmm. So that's a plus. And because you can go see who you want to see, it will encourage consumer shopping, mm-hmm. right? So, it might encourage some patients to look around, and then that in turn may make providers offer some type of transparent, competitive pricing. So yeah, we'll see.
And I'm gonna jump in right there. I think you hit one of the things I would have said immediately when I heard, okay, we're going to give you the funds directly. Okay, number one, we're giving you the funds to now do what you want, which I think is always going to be a lot better for people because there's transparency. But I think the next part that's huge is that it encourages people to be better consumers. Now, some people are not going to be good consumers. They're going to get this money and give it all to one person, and $1,000 is gone in the blink of an eye. That's because they're not educated and have health literacy to know what to spend money on and what not to spend money on. How much is a good price and how much is price gouging. That's why that's a problem. So unless you educate folks on that, that's going to be a problem. But the second thing that's going to possibly make that better when you hand in the money to somebody is that you are potentially going to encourage competition. So now if someone is definitely pricing skyrocketing at the top of the market, and someone comes in and gives a more reasonable price, more than likely people are going to gravitate to the more reasonable price. It's like when you go shopping at a grocery store. If somebody has sodas, or as we like to say in Louisiana, cold drinks on sale, you're going to probably find that a lot of people end up finding the sale and shopping at that store versus the people who have it at full price. So that encouraging of competition, I think, is huge, and a huge thing that we need more of when it comes to healthcare. Because right now, where's the competition, Patient Zero? If you had to try to find competition in healthcare, where's the competition?
DPC.
I think DPC for sure. The other side of it is it's between insurance companies. Like they're competing against one another. There isn't any pricing competition from hospital to hospital, from clinic to clinic, from surgeon to surgeon, because no one knows how much anything costs because you don't pay for it directly. And because you don't pay for it directly, you don't know where the price point is. So how can you have competition? How can you price? How can you look at price and then shop around? You don't. You literally just say who's in the network, and then you go to that place. And at that place, if they take your insurance, you basically get care. And at that point, you don't know how much it costs until you get a bill 6 months later. So removing that smoke and mirrors, that mysterious barrier to transparency that literally allows us to now have more competition, and that allows us to spend better as consumers. And I think the last thing you said is it's going to expand DPC. We already know this to be true because when you give people the option to pay for things directly, and it makes things more efficient, it makes things more cost effective, people love it. I don't care what you say. If I literally told you you can buy a flight on a plane and you can go through a third party and they won't tell you how much it costs, you just have to trust that they got you the best price and they'll tell you the price 6 months after you took the flight. Or you could just basically shop online and find the price that works for you and pay for it. I think most people are going to go with option 2, PatientZero. Am I wrong about that?
No, I think you're exactly right.
So if that's the case, that's the idea that I think are the 2, if not 3 biggest points. As you said, it's going to encourage people to be better consumers. It's going to encourage competition in the market, and it's going to potentially open up DPC a lot more because while you can't do a whole lot with $1,000 in a year from an individual standpoint, you may be able to get access to direct primary care and cover the majority of your cost, or depending on where you're located when it comes to DPC, all of the costs for the membership through that DPC model. So now you have access to a primary care doctor who now can give you transparent care, competitive pricing, and allow you to do this in a way where you're a better consumer. And at this point, you're getting healthier without breaking the bank. So I think that's a huge win across the board for this act. Now, outside of that, PatientZero, I don't know if we had much else. Like we had a strong 3.
Those benefits sound great if they're giving you more than $1,500. I'm just saying.
Again, we couldn't give you more than $1,500 out the gate, PatientZero, because we know you wouldn't know how to act. Like, I mean, you going out buying all these extra prescriptions you don't need, my friend. You going out getting extra surgeries. That's why they said
I'm gonna have Band-Aids that's the same color as my skin. You ain't even gonna be able to see the Band-Aids.
You getting flesh tone?
I'm gonna be living it up, bro. I'm gonna be like a Saint Lunatic in the early 2000s. I'm gonna have a Band-Aid on my cheek, have Band-Aid on my shoes. Yeah, bro. And my throwback jerseys and in my Jabos.
There you go.
I'll be stomping in my Air Force Ones.
There you go. And that's when the young people go realize how old you really are, because clearly the Air Force Ones are no longer the cool shoes, if I remember correctly. Did I hear that correctly?
Bruh, somebody called Air Force Ones dad shoes. First of all, when's the last time you had a pair of Air Force Ones?
Myself, it's been a little while. I'll be honest. I think I had to get rid of them when I moved once or twice.
So I wasn't big on them because the soles are like huge. Mm-hmm. So like I used to wear them when I was younger. Mm-hmm. But they came out with that NOLA pair, mm-hmm. with the shout out to like Cash Money No Limit with the gold and platinum check. They got NOLA written on it.
Yeah,
I was like, I have to get this pair of Air Force Ones. Not an Air Force One guy anymore, like talking about, but I had to get that pair.
Correct.
And I made the mistake of walking in the airport with them shoes. Oh my God! I felt like I was walking on 2 bricks. I felt like I was walking on 2 bricks. I'm like, Nike, y'all wrong for this, because I know for a fact that them shoes weren't that uncomfortable back in 2002.
That's right. That's
right.
right.
Like now, like maybe, my feet are a little different. I'm a little older, but there's no way that them shoes are that much. Like my feet changed that much to where they went from being comfortable to feeling like 2 bricks. Right. And then, dude, I was walking in Bush Airport. Do you know how much of a walk Bush Airport is when you got a connection there?
Oh, yeah.
Boy, them dogs were howling. I wouldn't buy a pair of Air Force Ones right now. I'm just saying.
You wouldn't wish that on your worst enemy kind of thing?
I'd wish it on my worst enemy. I'd wish it on my worst enemy. Hope your feet hurt.
I wish their feet hurt. That's how you know you're getting older. That's your disrespect. It's not like, I hope you have X, Y, and Z, something's really, really dark. It's more like, I just hope your feet hurt and you got to walk a far distance.
Yeah, man. I'm too scared of karma, bro. So like, I wish stuff that's like irritating on people, but that's like not really like life impactful. Like I wish aggravating stuff like I hope you scratch your rim at the grocery store, like stuff like that. Like stuff that are like really upset me. Like if I walked outside and I saw my rim was scratched,
You would be
It really
upset. Yeah.
bothered me. But
I
like,
know a lot of
it's not
people
gonna
who
hurt me.
probably wouldn't notice that.
So, first of all, if you don't notice your rim getting scratched, I don't need to ride with you.
You're living on the edge.
So you just don't care about nothing. Like first of all, how do you not notice you scratch your rim on the curb? Number one.
Yeah. Yeah.
And number two, why don't you care about that?
Well, I'll just say that some people just are risk averse and some people are risk tolerant, right? So I know you and I are on the risk averse side. And that's why I said, I'm not surprised that you would feel that way. I probably would feel the same. It would make my skin crawl, but I think some people are going to just be like, well, the tire ain't deflated. I'm just going to keep going.
Yeah,
So,
that's
am I wrong
irritating.
with that? Yeah. So anyways, based off of that, like you said, going back to the subject matter, and again, this topic isn't really the most robust because for the most part, it's not really complex. It's really we're trying to find something to replace something we deem that's not sustainable, which I'm not knocking it, giving insurance companies almost a blank check to subsidize care to keep it affordable. Well, I mean, the opposite of that is maybe just try to get the prices down on the insurance side. That could be a thing, but why would we do that? So instead, what we're doing is just going to keep doing the foolishness of just moving money around from people to people and not giving it to people who need it. So I don't know.
Well, you know what this is?
What's that?
Every year we do like a turkey drive, right?
Yeah.
Like and shout out to the frat. We had a turkey drive at the MLK Center right by Southern University's campus. We gave, I think it was like 40 turkeys, right?
Mm-hmm.
So imagine and it was a nice dinner, like had turkeys, all the fixings and everything, right? So imagine us going from that to next year we handing out fish sticks.
I agree.
That's what this is. We went from a nice turkey dinner to giving out fish sticks.
Well, I'm going to use your Band-Aid analogy somewhat. I think this is basically putting a Band-Aid on a hemorrhage. It's not a paper cut. It's not a small laceration. These people are bleeding out and you just like, I got it.
Nope.
$1,500 for a family, right? Like it's insane. And this is what we deal with when you have a lot of people who are out of touch writing policy in healthcare when most of them have amazing health coverage. So they have no idea how much anything costs. They are listening to people who have no interest in lowering the cost of healthcare. And they just keep on running up a bill and then wonder why everything is so overpriced and things are so inflated. Well, it's because you don't want to lower prices, especially in healthcare, for people to get better. You just want them to literally stay sick or not have access. And if they are sick and don't have access, then the price continues to go up. And that's why we're going to have this problem repeatedly. So PatientZero, again, as we've already said, this isn't a complex topic. It's not the most robust topic like some of the episodes we just did earlier in the season. This is really basic to me that the concept started out and has some merit, but they literally didn't stick the landing. It literally is a bunch of somersaults, flips, turns, and twists. And then when it comes to stick the landing, it's just basically falling, tearing all your knee up, tearing your ankle up, and now you got to limp home because you clearly did too much and wasn't ready for the landing. So I don't know. Am I missing anything? Anything else that you thought of when we went over the notes that you said, you know what, this was something I thought we should talk about, or did we cover it all?
I'm pretty sure we covered it all. It's, you went from a Cadillac to a Geo Metro. It's underwhelming.
It got 20s on it though, brother. It got 20s on it.
Nah, they got 17s, but they clean though.
They clean though, exactly. So all that being said, PatientZero, anything you want to leave the people with for this episode? Because like I mentioned to you, not much we can say other than do better, legislators. But hey, I'm gonna save my last thoughts for my little soapbox. Anything you want to give the people,
sure,
tip wise, advice wise.
I mean, you mentioned earlier at one of the three pros, because I feel like the whole show was cons outside of the three pros.
Mm-hmm.
When we talked about encouraging customer shopping for care,
mm-hmm.
right? And again, man, I feel like I sound like a broken record. Do your research. don't just keep doing the same old thing,
Mm-hmm.
because the same old thing not only is going to give you the same results, but the same old thing now is going to become more and more and more expensive.
Agree.
Just crunch your numbers, do your research, and make decisions that's best for you.
Mm-hmm.
Because if you were in the grocery store, you're going to compare prices because those products are sitting right next to each other.
Mm-hmm.
If you're car shopping, you're going to car shop and try to get the best deal because there's other lots and comparable vehicles to what you're looking at.
Mm-hmm.
Healthcare should be no different. We're telling you, and I feel like we talk about this every week, the pricing is going to skyrocket. Do the best you can to absorb the blow and get the best care that you can get. Just do your research. That's all I'm saying.
Absolutely. I'll wrap up by saying we definitely don't have a lot of pros. I think we covered them. We may missed one or two. And again, if you are a diehard listener with us, feel free to share messages, comments, thoughts on this episode that we may have missed. But I think the thing that is probably most problematic for me that stands out that I'm going to leave people with is the idea, like you said, equality versus equity. In healthcare, you can't think that giving people equality is the strategy to get people better. You have to give people equitable care. So if someone needs more resources, you can't penalize them because they're next to someone who feels, and I quote, that they need to do this the same way I did it. No, they don't, because your situation may be 10 times different than theirs. They may not have nearly as many resources or financial means to do any of the things that you did. So why are you penalizing someone for having a bad hand or having something negative happen to themselves? And now we're basically just saying, look, get yourself out of this hole that you may not have put yourself in the first place. And yet we just think that that's the way it should be. So by doing this, it's not really and truthfully sitting here saying, you know what, we know equity is the way. Their mind is, look, everybody's equal. We're just going to give everybody the same. And we hope that everybody's going to figure it out. And all it's going to do is cause a wider divide, PatientZero. You're going to have the healthier, richer people getting better. And you're going to have the sicker, poor people getting worse. And I think altogether, that's not what we want to do, especially when it comes to our clinic and our practice. We want to make sure everybody gets the care that they need and deserve. And that can be drastically different from you to the next door neighbor, to the person across the street, to the person uptown. Everybody gets care based on what works best for them. I have patients who have the same diagnosis and on 3, 4, 5 different regimens that get them better because they need slightly different things, even though the diagnosis on paper is the same. So if you are thinking like that equity is the way, I think this can shift and hopefully morph into something better, maybe morph into something that can be a good replacement. Maybe not now, maybe 2, 3 years from now, but it could be something to start that goes along with the subsidies, and the subsidies are decreased. And instead of the funds going to the insurance company, it comes to you and I, and pairs with the subsidy to where we're kind of doing both. I think if we can do that, we may be on to something, PatientZero. All right, so we're going to officially close out, my friend. Where can the people find you, PatientZero?
They can find me at Beckner Media on Instagram, George_Beckner on Twitter. I will continue to call it Twitter because I like Twitter. And George Becknell II on LinkedIn.
All right. And for us, you can find us at our website for the clinic, www.byja.org. For the Charitable Alliance, our nonprofit organization, www.byjaca.org. On social media, LinkedIn, we're at Byja Clinic, and Facebook and Instagram, it's at Byja Clinic as well. And last but not least, if you have not done so, you need to like, subscribe, follow, share, rate, all that good stuff. Because again, if you're listening to us, that must mean you enjoy us. And more importantly, you think we're doing good work. So please, please, please help us stay on the air, number one, by showing love to us for the work we're doing. Because again, it's not easy. It takes commitment. And we're usually here at least once a week, dropping important information to you, your family, your loved ones, all that good stuff. So give us that that love Patient Zero. I think that's a fair ask if I'm not mistaken.
Nah, that's absolutely fair. We need that from y'all. Like, come on.
There we go. There we go. All right, my friend. Well, I think we're ready to close out. And at this point, let's plan to finish the 4th season strong. I think we got 2 episodes left, and we'll go from there. So thank you all for listening, and we'll see you next time.